What is the difference between a thrombus and an embolus? Today, we will answer this question, discuss their causes, treatment options, and review a case study. A thrombus is a stationary blood clot that forms within a blood vessel, obstructing the flow of blood. It usually occurs due to a combination of factors such as damage to the blood vessel wall, changes in blood flow, and an increased tendency for blood to clot. Common causes of thrombus formation include prolonged immobility, surgery, trauma, and certain medical conditions like deep vein thrombosis. On the other hand, an embolus is a moving clot or other foreign material that travels through the bloodstream and then gets lodged in a blood vessel, causing a blockage. Unlike a thrombus, an embolus is not formed at the site of the blockage, but is carried from another location. The most common type of embolus is a blood clot that originates in the deep veins of the legs and travels to the lungs, causing a condition known as pulmonary embolism. What are the etiologies of thrombus and embolus formation? As mentioned earlier, thrombus formation can be triggered by factors such as immobility, surgery, trauma, and certain medical conditions. Additionally, conditions like obesity, smoking, and hormonal changes can also increase the risk of thrombus formation. Now let's consider an embolus. Embolus formation is due to a blood clot that breaks off from a larger clot in the deep veins of the legs. This can occur due to factors such as prolonged immobility, surgery, pregnancy, and certain medical conditions like atrial fibrillation. Moving on to treatment options, both thrombus and embolus require immediate medical attention. The primary goal of treatment is to dissolve or remove the clot and restore normal blood flow. Medications such as anticoagulants or clot-dissolving drugs may be prescribed to prevent further clot formation or dissolve existing clots. In some cases, surgical intervention may be necessary to remove the clot or repair the affected blood vessel. Now let's look at a case study to better understand the impact of a thrombus and an embolus. Meet John, a 55-year-old man who recently underwent knee replacement surgery. Due to the immobility following the surgery, John developed a thrombus in his leg. Unfortunately, a portion of the thrombus broke off and traveled to his lungs, causing a pulmonary embolism. John experienced sudden shortness of breath, chest pain, and dizziness. He was immediately rushed to the hospital, where he received anticoagulant medication to dissolve the clot and prevent further complications. In conclusion, understanding the difference between a thrombus and an embolus is crucial in recognizing the causes, symptoms, and treatment options for these conditions. Prompt medical intervention is essential to prevent serious complications and ensure the best possible outcome for the patient.